Hello everyone, my name is Asli Beyza Gul and I hope everyone had a lovely lunch earlier. And today I'll be talking to you about advancing Parkinson's care management and using integrative technology solutions for enhancing patient management. So like I've said before, my name is Asla. I'm a medical student at Aston University. I'm also the founding president of our Aston Neurology Society, and I'm a future neurologist with a passion for geriatrics. So I'm aware that all of you here are experts in your fields, but let's just run through the basics of what Parkinson's disease really is. So Parkinson's disease really arises from the lack of two main neurotransmitters, which are dopamine and norepinephrine. Now, dopamine is the major issue with this disease because dopamine is made in the brain through a two-step process. And so the amino acid called tyrosine, it changes into the substance called dopa, which then becomes dopamine in the region of the brain called basal ganglia. Now, the problem is that there are these prominent signals that are sent that produce dopamine, but in this disease, these signals are not sent, so there's a chemical imbalance, and this results in less dopamine. The chemical imbalance here causes the motor symptoms of Parkinson's, and these include tremors, stiffness, rigidity, which I'll be talking about in a bit. Norepinephrine is also very important because it is usually very responsible for the skeletal muscle contraction, and it plays a major role in the sympathetic nervous system. And people believe that this is the main reason non-motor symptoms arise in this disease. Now, Lewy bodies also play a very important role, in which are they're clusters of proteins of alpha-synuclein. It's not very clear as to why this is associated with Parkinson's as of now, but it is something that has been popped up a bit recently. Now, the causes of this disease, age is a big one. As people age, the nerve cells in the basal ganglia start to degenerate, and this results in a lack of signals to produce dopamine. Gender is also a big one. They found out that men are 1.5 times more likely to get Parkinson's than women. And this is due to the estrogen hormone providing a bit of a protective effect on the nervous system. Now, the other one is environmental factors, like Dr. Patty has stated earlier. Things such as chemicals, toxins, being exposed to these kind of increases the fact of getting Parkinson's, basically. Another controversial one is head trauma. Brain is very fragile, and so getting increased repetitive trauma, kind of like hitting on the head, tends to increase the likelihood of getting Parkinson's. Now, the symptoms of this disease divides into two, which are motor and non-motor. Resting tremor is a big one. Bradykinesia, which is a term to describe slow and minute movements, and it includes freezing of gait, mask face, and micrographia, which is smaller handwriting. And non-motor symptoms, they're usually the more life-affecting ones for these patients. Hypersomia is the term given to the patient when they lose sense of smell and hence the lose of taste. Psychological issues are a big one. People with Parkinson's tend to experience depression and anxiety quite a lot. And the last one is urinary and digestive system issues, which is due to the lack of mobility with this disease. Now that we have reminded ourselves as to what Parkinson's is, here are the problems that these patients have been facing in the last few years. Now, obviously, the pandemic was very affecting for all of us, but it was even more affecting for people with movement disorders. Not only were they not able to go to hospitals physically, they were also scared to go to hospitals because they could contract COVID, and this could make their case even more difficult to deal with. Dependency is another one. They were even more dependent, especially during the pandemic, to their caretakers. So this made it very difficult for these patients to be monitored and the disease to be monitored properly. And this was due to the requirement of close follow-ups, and this was not possible during these unprecedented times. Okay. So we as humans, we're pretty adaptable, and here were the recent developments that we've come up with. And the first one being virtual clinic by this company called Abbott in the US. They basically regulate the patient from miles away, and this is life-changing for these patients. UCL has created a mobile app to gather real-world data on these patients, and it helps these patients to independently track the progression of their disease. Bristol has got a new system to gather quantitative data through technological wearables. And this helps to understand the quality of the mobility activities of these patients in a normal daily life. So let's first talk about telehealth in Parkinson's especially. Telehealth was not really a new thing, but it got more popular during the pandemic due to the obviously obstacles we've got to face with. But I feel like we need to talk about something first. So the virtual clinic was a big thing for the deep brain stimulation treatment. And this is because this treatment method is very precise. This treatment method is basically when a surgical operation of electrodes are done, and they basically act as neurotransmitters. And there are four main parts to this stimulation system. The first part being thin leads that have electrodes at the end of them, which are inserted into the brain, specifically the basal ganglia. A small pacemaker-like device called a pulse generator that generates electrical impulses, extension leads that connect the thin leads to the pulse generator, and then an online system to control and adjust electrical signals, which also controls the stimulation and turns the device on and off. Now, it sounds like science fiction, but it's genuinely so interesting. Now, there are a few things that we need to consider before going through with this procedure. And the first one is as to where in basal ganglia we should insert. The basal ganglia is separated into a few parts, and the subthalamic nucleus, the globus pallidus internus, and the ventral intermediate nucleus of the thalamus. And each parts are responsible for different symptoms. So there needs to be a holistic meeting done in order to kind of decide on as to what point they should be inserting. Also, the patient needs to meet a certain criteria, and this is to be levodopa responsive. Even though they might have the DBS treatment, they still will need to be on levodopa to control the stimulations. And a cognitive assessment must be done by the multidisciplinary team. Now, basically, it's a drilling of a hole and insertion of electrodes, and the patient is after this procedure, the patient is reawakened and their abilities are tested. And then a pulse generator is inserted right under the collarbone. Now, the virtual clinic makes it it makes it a very beneficial thing for them. Basically, it helps to remotely control deep brain stimulation. Now, virtual clinics, they provide the convenience and the flexibility of remote care, so physicians can not only see their patients, but optimize their treatment pathways from multiple blocks away, or even from an absolutely different country. It helps people to strengthen their relationship with their doctor by extending care beyond the clinical walls. Remotely, the doctor can make sure that their patient is getting the best therapy possible and helps them to live more in the moment and have a better life quality, in simple words. It increases efficiency in a very significant way, and the symptoms are supervised from anywhere across the globe. Now that solution is done with, we've got UCL, which has created a mobile app for real-world data gathering, and this makes monitoring so much easier. So UCL has tackled a different problem that is quite frequent in clinics, and that is that symptoms of especially movement disorders tend to vary quite a lot from day to day. For example, they might show up on their best day to the clinic. However, the next day after they go back home, they might be it might be their worst day yet. So these regular checkups, they're not always the most representative, and this needs to be thought through. So UCL thought of this, and they came up with Cloud UWERP DRS app, and it basically includes a self-assessment question system, and it includes physical tests, which is enabled by the smartphone's movements, and it has touch sensors to measure symptoms such as tremors and gait, and these are very life-affecting for these patients. And it has been tested to be proven to be highly accurate as well. So this would be definitely a whole new chapter for Parkinson's management. The next one is continuous monitoring for these patients. So Bristol has come up with wearable tech to track progression, and this is basically wrist-worn wearables, and they are integrated with AI-enabled cameras to capture the patient's physical actions over extended periods. Now, the data from these wearables, they can be used to give metrics of the quality of mobility-related activities. Now, it's very important because to be able to come up with a new drug for this disease or any other movement disorder, a lot of data needs to be gathered, and this means the patients would have to come to the hospital, or the health team would have to go and track them down. And obviously, it's very difficult for these movement disorder patients. And so it helps to gather data for new drug trials from the comfort of the patient's home. Now, I believe this is the future of Parkinson's management. If you were to think about it, Generation Z, which is my generation, in about 20 years' time, will we have to face these movement disorders or any sort of neurological disorders? Now, these systems, I believe it will definitely get better in the next few years, but they help to increase flexibility, and it allows them to be tracked from any time at anywhere at their necessity. And it allows them to be connected to their healthcare system as well as a doctor, and helps to provide a very holistic care. That is it from my side. Thank you so much. Any questions?
It's an invasive process. Once you are putting the electrode deeply in there, so it is going to be the invasive process, and patients are generally managed remotely by the applications of the apps. So once some invasive process is done with the individuals, there is always proneness of developing some infection. How do you control, since the patients are not in the controlled environment, medical setting? They are placed remotely. So, and they are getting exposure to by this kind of the environment around. So how do you control or refrain the patient not to develop the infection after the invasive process?
So that's a very good question. Thank you so much. I believe with the virtual clinics, it is done to certain patients. Like I've said before, there's a big selection criteria to be going ahead with this procedure, as well as the system itself. But the thing is, as far as my knowledge goes, the deep brain stimulation patients are tracked down after post palliative care, and as well as when they are approved as not having any sorts of infections or any sorts of post-procedure complications, that is when they're cleared off to take the clinical approach of using virtual clinics.
I was just going to chime in that there's a low but finite incidence of infection associated with electrode implantation, but once the tiny incision is sealed up and the pulse generator is implanted and all that sealed up, infection is not a problem. Okay.
Do you think like this brain stimulation can be done in non-invasive manner also by any mode of?
I mean, that's definitely something to consider, but I don't think it's a possibility, because these electrodes need to be inserted deep into the brain in order to have an effect. So I personally don't think so, but it's definitely something that could be worked upon.
Thank you.
Thank you.
Okay.
Now it's time to give a certificate of appreciation as a young researcher award that will be given to you.
Thank you so much.
Then you go back, because you are going back now, is why we give you the certificate in the same moment that you finish your talk. And thank you so much for your talk. It was really excellent. Everyone enjoyed. And yeah, you can email in the middle. You can go, can you come from the other side? Yeah. It's one.